Hi. Last session we have seen threatened abortion. Next, inevitable miscarriage or abortion. In this we are going to see definition, clinical features and management. So here definition. It's a clinical entity or clinical type of abortion mm, where the changes have progressed to a state where continuation of pregnancy impossible. So it's a clinical type of abortion where the changes have progressed to a state where continuation of pregnancy is impossible. In threatened abortion, what? It is a clinical state. It has not progressed to a state where continuation of pregnancy is impossible. That means in threatened can continue pregnancy, but here continuation of pregnancy is impossible. Suppose इसमें क्या थ्रेटन में क्या होता है, स्लाइट ब्लीडिंग हुई प्रेग्नेंट वुमेन को, तो इफ इग्नोर किया तो इट में लीड टू इनएविटेबल सिवियर ब्लीडिंग होकर ऑल द फीटल कंसेप्शंस विल कम आउट. बट अगरचे इन थ्रेटेंड अबॉर्शन इफ प्रेग्नेंट वुमेन टेक प्रॉपर ट्रीटमेंट, थोड़ा सा ब्लीड होते ही गायनोकोलॉजिस्ट के पास जाकर ट्रीटमेंट लेने से क्या continuation of pregnancy can be possible. But here in threatened the changes have progressed, इतना change हो गया है कि then where the continuation of pregnancy is impossible. Next we'll see clinical features. Increased vaginal bleeding, aggravation of pain, that is in the lower abdomen, which may be colic in nature. Next, internal examination reveals dilated internal os of the cervix through which the product of conceptions are felt. जब internal examination किया जाता है तो product of conception can be felt through the cervix. जो भी fetal parts है बेबी के जो fetal conceptual material है can be found. So the feature may develop quickly without prior क्लिनिकल एविडेंस ऑफ थ्रेटेंड मिसकैरेज. थोड़े केसेस में क्या होता है, थ्रेटेंड अबॉर्शन में थ्रेटेंड होते ही थोड़ा ब्लीडिंग आते ही स्लाइटली दे विल गो टू द हॉस्पिटल, दे विल टेक द ट्रीटमेंट. बट यहाँ पर थ्रेटेंड थोड़े केसेस में थ्रेटेंड अबॉर्शन मतलब थोड़ा ब्लीड भी नहीं होता है, डायरेक्टली दे विल हैव सिवियर ब्लीडिंग एंड प्रोडक्ट्स विल कम्स आउट एंड प्रेगनेंसी continuation of pregnancy is impossible. So in the second trimester, however, it may start with rupture of the membrane. सेकंड ट्राइमेस्टर में अगरचे ये इनएविटेबल अबॉर्शन होता है तो रप्चर ऑफ मेम्ब्रेन्स, जो यूट्रस जो फीटस एमनियन कोरियन है, रप्चर ऑफ मेट्रेस मेम्ब्रेन्स विल अकर. इट इज़ कॉल्ड एज लाइक मिनी लेबर. ये मिनी लेबर के बराबर ही होता है मिनी लेबर. लाइक कॉन्ट्रैक्शंस होते हैं, बेबी पूरा इट विल कम आउट. सो दैट इज इनएविटेबल अबॉर्शन. नेक्स्ट मैनेजमेंट. सो एक्सेसिव ब्लीडिंग शुड बी कंट्रोल्ड बाय मेथर्जिन. 0.2 mg of methergine should be given if the cervix is dilated and the size of the uterus is less than 12 weeks. So we can give methergine 0.2 mg. And if it is less than 12 weeks, यानी कि तीसरे महीने के अंदर है, so the bleeding blood loss will be corrected by the IV fluid therapy and blood transfusion. Active treatment. So here यहाँ पर बिफोर 12 वीक क्या होता है, आफ्टर 12 वीक क्या होता है. सो बिफोर 12 वीक्स दैट मीन्स 3 months के अंदर इफ अबॉर्शन इनएविटेबल अबॉर्शन अकर, so dilatation and evacuation followed by the curettage of the uterine cavity by blunt curettage using analgesia or under general anesthesia. So dilatation and evacuation, it's a procedure where uterine cavity will be emptied. उसमें जो conceptual material होता है यूट्रस में, suppose imagine this is a uterus, in this baby's material. So while doing dilatation and evacuation procedure by the curettage, will be removing this conceptual material outside under general anesthesia. And alternatively suction evacuation also can be done. Suction evacuation means it's a surgical procedure which cervix will be dilated and vacuum is used to remove tissues from the uterus. So here vacuum is used. Dilated means open, cervix is opened. So this is about the dilatation and evacuation, suction and evacuation. In detail we will be reading about this, what is DNE and DNC and suction evacuation. Next, after 12th week. So here uterine contraction is accelerated. So after 3 months the baby has been grown at the 4th month, and here contractions is accelerated by the oxytocin drip. Here we will be giving oxytocin drip for pain contractions, so that the baby can easily, the fetal material can come out, expelled out easily. So this oxytocin drip is given 10 units in 500 ml of normal saline, that is 40 to 60 drops per minute. If the fetus is expelled and the placenta is retained, fetus बाहर आ गया है या placenta अंदर रह गया है, तो वो it will be removed by the ovum forceps. And if lying separated, if the placenta is not separated, then we have to go for digital separation by its evacuation, and it's to be done under general anesthesia again. So this is our active treatment. So this is about the inevitable miscarriage. In next session we will see complete and incomplete abortion. Thank you.